Welcome back to our channel, and let's review another NCLEX priority question. The nurse is reviewing a new medication prescription for assigned clients. So there are going to be 4 prescriptions for 4 different types of diagnosis. And the question is, which of the following prescriptions should the nurse clarify? So whenever we hear the word clarify, we're looking for a prescription which does not match, so something is wrong with it. Let's have a look at the options. So option number 1 is amoxicillin for a client who has respiratory infection and is at 20-week gestation. Amoxicillin is an antibiotic, you guys know. Definitely it's good for infection, but the put-off is 20 weeks gestation. Is it okay to give a 20-weeker an antibiotic? If you are unsure, you can always mark it as a question mark, and then we can just mix and match it with other options. Alteplase for a client who's experiencing an ischemic stroke and had spinal surgery 1 week ago. For this, you must know this drug, Alteplase. From your cardiopharmacology review, you all must remember that Alteplase is a fibrinolytic agent. And fibrinolytics are used for ischemic stroke because ischemic stroke has clot. And for breaking down the clot, we need this medication. But the put-off here is, this patient had a spinal surgery a week ago. What is going to happen? What is this patient at risk of? Pause the video and note that thing down. This patient is at risk of bleeding, and bleeding is a circulatory problem. The next option says labetalol for a client who's experiencing hypertensive crisis and sinus tachycardia. Okay, let's have a look at labetalol, LOL. What is this medication? Pause the video and think about it. This is a beta blocker, an antihypertensive medication, which is useful in not only lowering the blood pressure, but also lowering the heart rate. So is this something we need to clarify? For sure, no. So number 3 is definitely not our answer. The next option is hypertonic saline for a client who has syndrome of inappropriate antidiuretic hormone, or you all remember it, SIADH from your diabetes lecture, and hyponatremia. Hyponatremia is a condition where sodium is low. So do we have this combination somewhere in our minds? Again, pause it, think about it, that is this the right combination? And you got it right. Yes, we definitely need hypertonic solutions, not only for SIADH, but also for hyponatremia to bump up the sodium. And I'm sure if you guys followed my fluids lecture, you guys remember this from there. So even this combination is all correct. So it's not our answer. Out of 1 and 2, how will you come at the right answer? Always pick what you know, because that is your concrete knowledge. So you know that 100% Alteplase is going to cause bleeding. Yes, that has to be the right answer. Even if you're unsure about 20 weeks gestation thing, don't worry about it. But let me tell you, it's not a problem. At 20 weeks gestation, a primary healthcare provider can give amoxicillin if it is needed. Hence, the right answer to this question is number 2, because it is going to cause heavy bleeding. Your patient can hemorrhage if they had a surgery a week before. If you want to know more information about fibrinolytic medications, you can comment down below and we can create a detailed video on that. If you like this video, click thumbs up, share it with your friends, and also consider subscribing to our channel. Thank you.